Good evening to everyone and welcome to today's wonderful evening. I hope that you're all brimming with all that energy. Yesterday, I could not get time to discuss the question paper, but next 35 days, we have a lot of time. So I hope you all have downloaded the Incus Learning app and you have 40 full-scale NEET PG mock test discussions, test and discussion. So every day morning when you wake up, don't forget to solve 100 questions. Hardly you will take 40-50 minutes. But that will help you to identify what are your strong areas, weak areas, where you need to improve, where are you doing wrongs. That is very important. There is also a PowerPoint of the discussion that we are going to have in the evening is already posted once you go into the history. So if you have any problem in understanding on the Incus app, where is the test, please feel free to call our helpline. So let's make the great beginning. Dr. Anupama and everybody who are all online, thanks for joining. So the lateral cutaneous nerve of the forearm, what is it a continuation of? It is the continuation of the musculocutaneous nerve, is what you need to remember. So the superior lateral cutaneous nerve of the arm is a branch of the axillary nerve. Lateral cutaneous nerve of the forearm is a continuation of musculocutaneous nerve. Posterior cutaneous nerve of arm is the branch of the radial nerve, is what you have to emphatically remember. The primary visual cortex, it is related to the calcarine sulcus. So what are the Brodmann areas, doctor? One of the favorite MCQs in the tomorrow's NEET PG exam. It is the Brodmann area 17, 18, 19, which are typically the classical visual cortical areas. The middle cardiac vein, it drains into the posterior interventricular sulcus. So between right atrium and left atrium, anteriorly, you have the left anterior descending artery which will be passing. But if you go behind the heart, then you have the posterior interventricular sulcus. Interventricular sulcus. And in that sulcus, you have the middle cardiac vein, is what you need to remember. So one of the favorite questions asked by the examiner, doctor, what is the venous drainage of the heart? Coronary sinus. It is the largest vein draining the heart. It opens into the right atrium between the opening of the IVC and the AV opening. It receives the great, middle, small cardiac veins. Similarly, the oblique vein of the left atrium and the posterior vein of the left ventricle. So now, if you take great cardiac vein, common MCQ asked is, what is the artery which is accompanying the great cardiac vein? So typically, the great cardiac vein begins at the apex of the heart. It ascends along the interventricular branch of the left coronary artery. It turns to the left to lie in the coronary sulcus, and it continues as the coronary sinus. So middle cardiac vein, it accompanies the posterior interventricular branch, which is the branch of the right coronary artery, and it also drains into the coronary sinus. Small cardiac vein, it also runs along the right margin of the heart, and it accompanies the marginal artery, and it drains into coronary sinus. Oblique vein of the left atrium, it also drains into the coronary sinus. But now comes anterior cardiac vein. Anterior cardiac vein, this is the favorite important MCQ, doctor. So I'm telling you once more, 4,000 MCQs, most expected MCQs in the tomorrow's NEET PG. I'm discussing in this 40 grand test from March 5th to April 15th. Just if you follow these 4,000 MCQs discussion and take the test daily, 100 MCQ test daily in the morning, whatever be your level of preparation, doesn't matter. Just sit peacefully, open the mock test and take 100 questions and then get yourself ready. And in the evening, follow the discussion. But that is the only secret mantra in the last 35 to 40 days for you to become the NEET PG topper. Even if you start today, I can make you and take you to become the topper, provided you should promise me every day you should solve the 100 questions sincerely, 1 hour by day, whatever be your level of preparation. Then there is a PowerPoint accompanying it. Just review through all the explanations. Then in the evening, participate in discussion. Then you choose about 5 to 10 topics out of these 100 questions. Coronary circulation, I'm poor. Coronary venous drainage, I'm poor. Let me bolt it. Retinoblastoma, I did wrong. Oh, I should do a revision. Retinitis pigmentosa, I did wrong. I should do a revision. Parkinsonism drugs, oh my God, I did wrong. Like that. 10 to 15 topics. Pick up from these 100 questions wherever you have done wrong. And there is a 2000 HD videos is available. Suppose if you are already enrolled with some other video program also, no problem. But go back to those topics where you are lagging behind in this mock test and then do the revision. Every day 10 topics, total 40 days made, 400 topics, you are fully ready. That is all required for the examiner, right? So winning is very easy, doctor. A lot of people have a wrong imagination. Itna padna hai, utna padna hai. Right from second year I should read, third year I should read. Second year, third year is the time where you should fall in love with somebody. Somebody should dump you or you should dump somebody. Somebody's WhatsApp you should block or your WhatsApp is blocked. There's a lot of fun in medical school. Don't miss that. And you need to run to the clinics, enjoy presenting cases. And one after the other exam, to pass itself is a big miracle. Whatever you read, just during internship, 40-50 days, you sit with me, I will tell you what to read. And do the revision of those topics. More than enough, you will become a winner. That's my promise to all of you. So don't over-imagine, oh my God, I did not read well anatomy. I did not read well forensic. You can't bring back the time that you lost, doctor. Tomorrow is certain. Yesterday is forgotten. Be very sure about it. And you need to live today is very important. So I hope that is the spirit with which you should approach the NEET PG instead of worrying about how much to read, what to read. 300 marks paper became 200 marks. What happens? Nothing happens. If 300 became 200, it's more easier. Some dustbin subjects like dermatology, psychiatry, which we never read, we can as well forget about it and focus on medicine, surgery, gynaecology, right? That's a good news. So, doctor, the parotid abscess, how do you drain? Basically, you take a horizontal incision. So, parotid gland is there. You take a horizontal incision, and to avoid the injury to the facial nerve is what you need to remember. The ventral pancreatic bud, it gives rise to uncinate process of the pancreas. So what I want to tell you, pancreas embryology is the favorite topic of the examiner, doctor. Be very sure. So pancreas, typically, if you look at the pancreas, how does it develop? So you should remember that it develops from a dorsal and a ventral pancreatic buds. And from where the pancreatic buds arise? They arise from the caudal part of the foregut. Most of the pancreas comes from the dorsal pancreatic bud, which appears before ventral pancreatic bud. Similarly, for the formation of this dorsal pancreatic bud, where will the signal come from? It comes from the notochord, activin and fibroblast growth factor 2. And the ventral pancreatic bud forms the uncinate part process, which is the part of the head of the pancreas, is what I want to underscore to all of you. Thank you, Dr. Anupama, for kind words. Sir, your motivation daily like this is very, very helpful. Let me also actually thank you. You know, I was a topper in 2000 batch in post-graduation when I took MD General Medicine. From then till now, I'm still studying anatomy, physiology, all because of this, you little buddies. You are all my life. And without spending an hour with you guys discussing the concepts, I don't feel like the day passed or I justified my existence. So much I became also equally addicted to all of you. So yesterday, the whole day, I went out for a small dinner in the family. So I had to skip the class. But throughout the dinner, I was completely on a very bad shape because I missed the class. So doctor, that way I too got addicted to all of you. Thank you for keeping this teacher alert. Like a young NEET PG aspirant, every day you are making me younger by about 2 decades. Now, Fick's law of diffusion, the diffusion of the lipid-soluble substances across the membrane. What is it dependent on? So you should remember this Fick's formula, doctor. The rate of diffusion is equal to the concentration gradient divided by the membrane thickness is what you need to remember. In the intestine, testis, who is the glucose transporter? Once more, this is batti marne wala item. Batti marne wala item. जहाँ बट्टी मारना है, मारना ही पड़ेगा, नहीं तो examiner छोड़ेगा नहीं. But this is something, doctor, if you look at the past 10 years of question papers, every time they will ask one question on GLUT receptor. GLUT1 RBC, GLUT2 liver, GLUT3 brain, GLUT4 skeletal tissue, heart and adipose tissue. GLUT5 intestine, testis, kidney, sperm for the fructose. GLUT6 is leukocyte and spleen. Among these receptors, only GLUT4 is insulin dependent, hence decreased in fasting. GLUT7 is there in the endoplasmic reticulum, is what you need to remember. So, to help you all guys, we are introducing a new concept called flashcards. Tonight we are launching these flashcards in the Incus app. Flashcards are like topic-wise. See, doctor, for example, if you take surgery, there are about 200 small topics, kutti topics. in surgery, like investigations of breast carcinoma. Similarly, mammography is one topic, like small, but very high-yield topics. Each has 40-50 points that you need to remember. So we are creating it like a flashcards. You can simply flip it and then label, are you sure or not sure? And accordingly, not sure cards can be revised in the last moment. More than 50% of the USMLE students use flashcards. We want to bring that trend even in NEET PG preparation, FMG preparation also. So tomorrow we are launching one new version of Incus app, and you will start enjoying the flashcards also. Now, what is the primary mechanism moving water molecules? It's the filtration. So basically, there's a diffusion, facilitated diffusion, filtration, osmosis of all. Filtration, which is because of the pressure gradient on the two ends, is the one responsible for filtering. Compared to ICF, ECF has lower potassium. So what is the major cation of ECF, doctor? Sodium. ICF, potassium. Major anion of ECF, chlorine. ICF, hydrogen and phosphate. So this is what you have to remember. So what is Donan's effect of the cells? Whenever there is any indiffusible anion, suppose cell membrane, two sides are there. So on one side, if you are having a negatively charged molecule but a big molecule which is unable to diffuse, then this in turn will hold some other electrically charged substances on one side of the membrane. That's called Donan effect. Charged particles near a semi-permeable membrane, when they fail to distribute, then typically they will lead to uneven electrical charge, is what you need to remember. A receptor on the membrane of the effector nerve or muscle cell, which a drug acts, it is the clonidine. So what is clonidine, doctor? Clonidine is an alpha-2 agonistic drug. So typically in the brain, alpha-2 receptors, whenever they are stimulated, they will decrease and inhibit the catecholamine release, and that will decrease the sympathetic output, which will help in controlling hypertension. That is the reason clonidine is used as an anti-hypertensive, because it is a alpha-2 agonist. And alpha-2, where is it located? It is typically presynaptic membrane. Whereas alpha-1, it is located on the postsynaptic membrane, is what you have to remember. Alkaptoluric patients, there's a darkening of the urine on standing. Thymine pyrophosphate, what are all the enzymes where it is coenzyme? Pyruvate dehydrogenase, pyruvate decarboxylase, alpha-ketoglutarate dehydrogenase, branched chain amino acid dehydrogenase, transketolase. For all these things, thiamine pyrophosphate is a coenzyme. Green leafy vegetables, if they are not there, no folate means neural tube defects. Anencephaly is what you need to remember. The brown red color of the feces is because of the Stercobilinogen Corynebacterium. I told you yesterday, day before yesterday. What is the sure short topic of the examiner, doctor? Culture media. You have to mug it, you have to eat it, you have to drink it. There is no other way for the tomorrow's NEET PG. Microbiology में कितने questions आएगा अभी 200 marks वाले पेपर में? Maximum 5 to 10. Just like AIMS exam. One question will be there on the culture media. That's what you should remember. So low blood serum slope is the enriched medium. So these are all oncogenic viruses, hepatitis B, Epstein Barr virus, human papilloma. Now, abhi aa gaya batti marne wala item, flashcards on Incus app. On every subject, I am going to give you around 5,000 to 10,000 flashcards, which you can start playing on the Incus app, and you can be able to bookmark those things which you are forgetting. Last moment, you can only revise those flashcards where you are going wrong. That's a very fast way of doing the revision. So now, doctor, he is my papa is the DNA virus. He, hepatitis. He, Epstein Barr virus. Papa, pox virus, adenovirus, papilloma virus. They're all DNA viruses. His salary feeds me. They're all RNA viruses. Human T-cell leukemia virus, sarcoma virus, feline leukemia virus, mammary tumor virus, etc., etc., etc. What are the most common fungal meningitis? Cryptococcus neoformans. Ganga behti hai. Ganga flows. Immunoglobulin that crosses placenta is IgG. Which factor contributes to H. pylori related gastritis? Urease, Vacc A, CAG A, they're all the cytotoxins. So H. pylori is a gram-negative, motile, flagellated, microaerophilic, catalase positive, urease positive, coccoidal organism and a biological carcinogen is what you need to remember. Now, doctor, gas gangrene is caused by septicum novoli perfringens, all of them. Persistent suppression of the bacterial growth that may occur after a limited exposure to the antimicrobial agent is called post-antibiotic effect. So if there is, even with a brief exposure also, if there is a persistent suppression of the bacterial growth, that is called post-antibiotic effect. Now, what are those antibiotics which are known to show the post-antibiotic effect? Post-antibiotic effect is my question to all of you. Most of the protein inhibitors, nucleic acid synthesis inhibitors, like aminoglycosides, fluoroquinolones, tetracyclines, clindamycin, newer macrolides, rifampicin, rifabutin, they all induce a long-term post-antibiotic effect. Whereas there is something called concentration-dependent effect. There is something called minimum inhibitory concentration and concentration-dependent antibiotics is those antibiotics which eradicate the pathogenic organisms by achieving a high concentration at the site of binding. They are called concentration-dependent antibiotics. So they will be able to kill the organism if their concentration is at least 10 times above the minimum inhibitory concentration. So aminoglycosides, fluoroquinolones are the classes of the concentration-dependent killing. Time-dependent antibiotics. Typically, their killing response is dependent on time. It doesn't matter how high is their concentration above the minimum inhibitory concentration, that doesn't matter. What matters? How long they remained above the minimum inhibitory concentration, that matters. That is called time-dependent killing. So what are the antibiotics which show time-dependent killing, doctor? Penicillins, cephalosporins, clindamycin, macrolides, linezolid. They all show time-dependent killing, concentration-dependent killing, and post-antibiotic effect. 3 terms मालूम पड़ गया ना? बस, more than enough. Now, which antibiotics act on the bacteria? Imipenem. So once more, doctor. All antibiotics. 30 yes, 50 yes, which yes. How do they act? बट्टी मारने वाला आइटम है. Mechanism of action of antibiotics. लिख लो. Write down in your target list. Whether you have attended coaching anywhere, I don't care. Or you are reviewing the video library in the 2000 HD videos on the Incus app, no problem. But without, out of the 10 questions they ask in pharmacology, 1 question mechanism of action of antibiotics nahi hai to my name is not Murali Bharadwaz, right? Now, 63-year-old, severe back pain, osteoporosis. So which vitamin do you want to give? Biscuit question. Vitamin D, because it increases the intestinal absorption of calcium. Which anti-seizure drug? Which anti-seizure drug? It elevates the plasma concentration of other drugs. Valproate is a protein binding displacer and a metabolic inhibitor. Atropine. It leads to dryness, tachycardia, difficulty in maturation, not constriction. Cholinomimetic effects. Cholinomimetic drugs lead to meiosis. Anticholinergic drugs lead to mydriasis. All of you know. It is an androgen receptor antagonist. So flutamide is the oral non-steroidal anti-androgen used to bring down the size of the pumpkin-sized prostate into a small grape size. You require flutamide. Now, Turner syndrome XO, mesothelioma versus adenocarcinoma. Once more, tumor markers. I'm going to give you a very nice 10,000 flashcards, topic-wise, in each subject shortly. That will help you to nicely mug those things that you have to mug. Right, doctor? So every subject will have around 1,000 image-based questions you need to remember. Around 4,000 to 6,000 single liners and 2,000 to 3,000 logical reasoning based and another 1,000 lists. Major subjects I am talking about. I'm going to make a nice flashcards for you. You start playing, bookmarking, identifying which topic your scores are little better, etc., etc. So, doctor, mesothelioma is distinguished by the presence of calretinin, cytokeratin, and the absence of carcinoembryonic antigen. So, cytokeratin, calretinin are mesothelioma markers is what you need to remember. Similarly, thyroid transcriptase factor 1 and the CDX2, they are also the markers. Peptic ulcers most commonly on the first part of the duodenum. NK cells, neither T nor B cell antigen receptors are there on them. And what are the CD markers for the NK cells, doctor? CD16, CD56. What are the bone-forming tumors? Osteoma, Osteoblastoma, Osteosarcoma, they're all called bone-forming tumors. In the brain, it is the liquefactive necrosis, whiplash injury, typically seen in the occupant of an automobile, bumper fractures, Usually it is the tibia which is fractured. If at all the victim of the rape, if their identity is being published, then it is a punishable offense under section 228A of IPC is what you need to remember. So a hallucinatory or a dreamlike state due to prolonged deprivation of the sleep because of the NEET PG preparation, what do you call it? Oneirophrenia is what you should remember, which is called a plant penicillin because of its broad spectrum of activity against various insect pests. Endrin. The National Rural Health Mission, the objectives are strengthen the PHC, ASHA workers, supply the Indian systems of medicine, not pulse polio. So you should know all the core strategies, supplementary strategies, etc. I leave the literature for you. Doctor, if you go to the Incus 2000 HD video library, PSM, we have about 60 videos. And biostatistics, another 20 videos, totally 80 videos of 20-minute duration are there. Please take every opportunity to revise. हमने गर्मा-गर्म discussion करके छोड़ दिया. So one TB unit covers 5 lakh population. So tuberculosis unit 1 per 5 lakh and 1 per 2,50,000 in hilly tribal area. Health adjusted life expectancy क्या होता है? The life expectancy at birth adjusted for the lifetime spent in poor health. See, last year we had all this COVID, BVD and all that. So we lost almost 1 year of life. Mental health also got deteriorated. RCH1 may what is not there. ASHA worker is not part of RCH1. So you should know what are the parts of the RCH1, RCH2. RCH2 main focus was rural healthcare, reducing maternal child mortality and morbidity. Revised National Tuberculosis Program. How many student samples should be tested, doctor? 3. Maternal health current program is NRHM, National Rural Health Mission. Under that, the Accredited Social Health Activists, ASHA. What are the eligibility for ASHA? What are the functions of ASHA? How much money is paid to ASHA? ASHA will report to whom? ASHA will train whom? What is do's and don'ts by ASHA? Everything about ASHA, nahi to nirasha. In the tomorrow's NEET PG Doctor, batti marne wala item hota hai, ASHA is what you need to remember. Similarly, Rogi Kalyan Samitis, Janani Suraksha Yojana, National Mobile Medical Units, Janani Sishu Suraksha Karyakram JSSK, Rashtra Bal Swasthya Karyakram, MCH Wings, District Hospital Knowledge Centers, National Iron Plus Initiative, all these things, doctor. Tasma Jagrata Jagrata. You have to be very careful, remember, and reproduce in the tomorrow's exam. All these are rodent transmitted. Oh, come on, biscuit question. Malaria is not rodent. All of us know that. General fertility rate, total fertility rate, net reproduction rate, all the rates मालूम होना है, नहीं तो MD का seat का rate बढ़ जाएगा. So the number of live births per 1,000 women in the reproductive age in a given year is called a general fertility rate, is what you need to remember. So what is the formula to calculate child survival rate? If you are given under 5 mortality, IMR, live births, etc. 1,000 minus under 5 mortality divided by 10 will give you child survival index. Child survival index. Thiomersal is a organic mercury containing preservative. What is the main source of the organic mercury in the world, doctor? Fish, machili, fish and shellfish are the main sources of the methyl mercury exposure to the human beings. Transstadial transmission is found in mite. Dairy milk can transmit cholera, TB, typhoid, any of them. How do you identify coarctation of aorta? There are two ways. Early identification is with congestive heart failure. Late identification is by the presence of the hypertension. So, very early, if they present, often they present with CHF. 50-year-old, increased thirst, polyuria, weight loss. Postprandial glucose is 210. What is your diagnosis? Straight diabetes mellitus. So the fasting plasma glucose level of 126 or a 2-hour plasma glucose of 200 milligram per deciliter or higher during a 75 gram oral glucose tolerance test. That is the ADA definition, is what you need to remember. Anakinra is a interleukin-1 receptor antagonist which is used in the management of rheumatoid arthritis. Once more, make a point. Monoclonal antibody. Sure shot MCQ. Liklo. Definitely आएगा. One of the monoclonal antibodies नहीं है तो कल के नीट पीजी में मेरा नाम मुरली भरद्वाज नहीं है. 65-year-old male, smoker. Now, smoker develops lung cancer. Lung cancer may SADH can develop. SADH will lead to hyponatremia. Hyponatremia is what you need to remember. Acute tubular necrosis can be caused by hypoxia, heavy metals, radio contrast. So you should know all the causes: cyclosporine, amphotericin B, norepinephrine, epinephrine, hypercalcemia. They're all strong renal vasoconstrictors that lead to the development of the acute tubular necrosis. Similarly, ACE inhibitors, ARBs, etc., etc. Similarly, cyclosporine, cisplatin, fosfamide, foscarnet, any of them can lead to pentamidine, hypozoitic, hypochromic anemia. Once more, I am telling you, iron deficiency anemia versus anemia of chronic disease. How do you differentiate? Day before yesterday only we discussed it now. Did you do a revision? Are you ready for the question in the tomorrow's exam? You should be ready, doctor. Now, hereditary lead to macrocytosis, not microcytic hypochromic anemia. MCV will increase. And there is an increased MCHC, which is characteristic features in the, MCV will decrease, not increase. MCV will decrease, but MCHC will increase in hereditary spherocytosis. So how do you identify and differentiate between thalassemia, which lead to microcytosis, and hereditary spherocytosis, which lead to microcytosis? Osmotic fragility. Typically, the most sensitive test for hereditary spherocytosis is osmotic fragility. Increased osmotic fragility is hereditary spherocytosis in a case of microcytosis. Decreased osmotic fragility is a sign of thalassemia, which is also presenting with microcytosis. Pheochromocytoma. Don't use propranolol like a pure beta blocker. Always use alpha plus beta blocker, or first give alpha blocker, then only beta blocker. Why? I will not tell you. Already we discussed this in a great detail in our 2000 HD videos for NEET PG preparation on Incus Learning app. Today only you download and then please do the revision. Then a Kindra, IL-1 antagonist. Mr. S. Sukumar Sudhakar received polyvalent antivenom for the snake bite. 2 weeks later, developed fever, polyarthritis, urticaria. That is called Arthur's reaction, bro. Arthur's reaction is a type 3 immune complex mediated hypersensitivity reaction. Low cardiac output in the shock. If there is any myocarditis, E. coli sepsis, tension pneumothorax, anything can lead to a decreased cardiac output. Sorry, pulmonary embolism. Not E. coli sepsis. E. coli sepsis is a septic shock. Septic shock leads to vasodilation, so increased cardiac output. Tension pneumothorax, pulmonary embolism, myocarditis, they are all low cardiac output. So hypovolemic versus cardiogenic versus distributive shock. How do you differentiate cardiac output? Hypovolemic, cardiogenic, cardiac output is low. Distributive shock, which is like a septic shock, cardiac output is increased. This is what you need to remember. 20 online classmates. Very good, doctor. Please tell all your friends. Every day, evening 6 o'clock, preferably 6 o'clock. March 5th to April 15th, I'm all yours. After that also, I conduct almost daily free classes on the YouTube, no problem. But what I want to tell you is, quantity is not important, doctor. Quality is important. Focus is important to become the NEET PG topper. You should know what examiner wants. It is not what you want to enjoy reading. Reading is always enjoyable. But what examiner wants? Are you ready with those topics? That is important. Okay? Now, 32-year-old want to undergo balloon valvotomy for a tight mitral stenosis. If it is a heavily calcified mitral valve, doctor, see, you have two options. Whenever mitral stenosis is there, you can do mitral valve replacement or mitral valvuloplasty, repair. You want to do replacement or repair? Replacement or repair? So there are certain criteria for that. Percutaneous mitral balloon valvuloplasty, valvotomy. It is not indicated if it is a very mild MS. Similarly, if it is a very severe MR or a left atrial thrombus, it should not be done. Similarly, if it is a thickened valve, subvalvular fibrosis, calcification, then also you can't do the repair of the mitral valve. So that is what you need to remember. I leave all this PowerPoint, everything on the Incus Learning app, doctor. So that's the reason, don't worry at all. Okay. Now, 20-year-old with seizure, CT scan shows neurocysticercosis. A lot of students, medical students, innocently think if you eat pork, if you eat beef, if you eat pig directly into your mouth, you will get neurocysticercosis. No. How do you get? Anything contaminated, it can be vegetable also. Anything contaminated with the X of the tinea solium can lead to. That can even be vegetarian. That's what you need to remember. So you should know the life cycle of the tinea, one of the favorite topics. 32-year-old truck driver, 20-day history of a dry, non-productive cough, progressively worsening. Oxygen saturation 85%. Oral thrush, truck driver, lassi piyo roadside mein red light area ko jana. So what is he having, doctor? HIV, pneumocystis pneumonia, cotrimoxazole is considered to be the treatment. APG is showing PSCO2 55, bicarb 14. First of all, you should know what are the normal values, doctor. Please, please, please don't forget. pH 7.35 to 7.45. PSCO2 3.5 to 35 to 45. Bicarb 22 to 26. PaO2 80 to 100. SaO2 95 to 100%. This is what you need to remember. So, in this case, pH is 7.2, so acidosis. PSCO2 55 बढ़ गया, that means there is no ventilation, respiratory acidosis. Bicarb is 14. Low bicarb means metabolic acidosis. Once more, what will you write in your diary with Dr. Murali Bharadwaz while you are becoming topper? Good to see Ahmad Raja, Rifa Riaz, and many more who are all across the country. Thanks for joining this session, doctor. Please come every day and send me a laddu in the WhatsApp. Sir, I became a topper. I'll be waiting for that wonderful moment, right? So, doctor, acid-base disturbances. Without that, there is no paper, doctor. 200 marks ke liye nahi hai, NEET PG. It is only for 199 because one question, two questions also sometimes. Jaroor aayega. If you don't know these values, how will you go to the exam? Difficult. Correct? Barabar. So once more, go back to the Incus Act, 2000 HD videos. Please do the revision. General medicine में हम दिल लगा के आप सबको पढ़ाया. HLA B27 belongs to which class of MHC now? Class 1. So humans have three main class 1 genes. HLA A, B and C. Then 6 main class 2 genes. HLA DPA, 1 DPB, 1 DQA, 1 DQB, 1 DRA, DRB, 1 is what you need to remember. Severe interscapular pain between the two shoulder blades. Oh my God, doctor, the pain is killing me, doctor. Do something, doctor. You have checked the pulse. Pulse is not felt. Pulse is not felt. In contrast, patient has a accelerated hypertension. So you should know DeBakey's classification and Stanford's classification. One of the most favorite topics of the examiner, doctor. Now, type 1, it is involving ascending aorta, also descending aorta. Type 2, only ascending aorta. Type 3A, only descending aorta. Type 3B, descending aorta along with abdominal aorta. It extended a little longer. So type 1 and 2 is also called type A, Stanford. Type 3A, 3B is called type B. So please don't forget. So why you need to remember, doctor? First tell me that point. Emergency surgical correction, if it is Stanford type A. So type A typically is involving ascending aorta. That means aortic valve is also involved, and that lead to aortic regurgitation. So that is the reason only surgical correction in ascending aorta dissection. So when will you do in Stanford 2B? Stanford type B. Stanford type B, if at all, there's an increasing size of hematoma, impending rupture, sacral aneurysm, bleeding into pleural cavity, etc., then only you will do. But otherwise, descending aorta dissections, not involving ascending aorta, like Stanford type B, their main treatment is medical management. Bring down the BP, decrease the shear stress on the wall so that you are decreasing the dissection. So lebetalol, propranolol, esmolol, you decrease the BP is what you need to remember. Now, doctor, long-term domiciliary oxygen therapy. One side 50-year-old married wife, another side oxygen cylinder, and the Major General who smoked throughout his life will be putting oxygen. So what they found is in COPD patients, domiciliary oxygen is preventing the pulmonary hypertension and the right ventricular failure. Now, the total serum calcium, total protein, serum albumin was given. How do you calculate corrected serum calcium? If you don't know the formula, you are clean bowled. You don't even enter semifinals. So 0.8 into normal albumin minus patient's albumin plus serum calcium. So 0.8 into 4 minus 2 plus 6 is the corrected calcium. Type 1, type 1, type 2 respiratory failure. What is the difference? You jumped into water. You drowned into water. Then what do you get? Pulmonary edema. So alveolar level pathologies, what will happen? Carbon dioxide can still diffuse if there is a pulmonary edema, but oxygen cannot come inside. That is the reason there is a hypoxia, normocapnia is type 1. If the problem is at the alveolar level, that is type 1. Just like you drown into water and type 1. Type 2. So when do you get type 2, doc? Let us say you are hanged till death. If you are hanging somebody, what will happen? CO2 बाहर न जा सकते, oxygen अंदर न आ सकते, CO2 बढ़ जाएगा, oxygen गिर जाएगा. That is called type 2. If you have hanged a person, tracheal level obstruction, if it is there, it is type 2. Hypercapnia plus hypoxia. That's what you need to remember. Dislocated legs, eledalus, morphin, homocystinuria, wheel Mercansery, hyperlysinemia, sulfide oxidase, everything you should know. What is the favorite dirty MCQ examiner asks? Upward, outward is morphin. Downward, inward is homocystinuria is what you need to remember. So morphin kaise rehta doctor? Tall fellow. That's the reason it is also upward, outward is the subluxation. Abba, actual question came. Medium vessel vasculitis, where do you see? Kawasaki. How will you remember Kawasaki is medium? See, doctor, lorry. If there is a lorry is a heavy vehicle, big vehicle. Tricycle or a cycle, small vehicle. Between the two, motorcycle is medium sized. Kawasaki Bajaj. So Kawasaki is what? Medium sized vasculitis is what you need to remember. Don't tell Dr. Murali Bharadwaz teach like this, but some way to remember. Large vessel vasculitis are fatafat bolo, Takayasu, polymyalgia rheumatica, temporal arteritis. Medium vessel, Burgess, Kawasaki, Pan, polyarteritis nodosa. All the remaining are small vessel, like Henoch-Schönlein, vagina, cryoglobulinemias, microscopic polyangiitis, etc., etc., etc. Right now. Now, supraventricular tachycardia, IV adenosine, critical illness polyneuropathy. Let us say you got a patient of organophosphate poisoning, somehow you have made him to survive, you have put him on ventilator, but he may develop critical illness polyneuropathy, where there is a neurological dysfunction, muscle weakness in the critically ill patients receiving intensive care, and it becomes difficult if this develops to wean the patient from the ventilator. Highly active antiretroviral therapy may, you are using stavudine, lamivudine, nevirapine. And what is the possible complication which can develop? So you should remember, doctor, NRTIs, nucleoside receptor reverse transcriptase inhibitors. What is the class effects? What are the side effects that belong to that class? Peripheral neuropathy, myopathy, pancreatitis, nephrotoxicity, lactic acidosis, hepatic steatosis. They're all the several adverse effects of the NRTIs. Hepatic steatosis, why does it develop in NRTI taker? Because of the mitochondrial dysfunction. If an NRTI receiving patient develops lactic acidosis, means almost always it is the hepatic steatosis. Now, zidovudine, known for myopathy. Stavudine, diadenosine, zolcitabine lead to neuropathy. Diadenosine, stavudine, zidovudine lead to lactic acidemia. And peripheral lipoatrophy is caused by stavudine, and diadenosine is known to lead to pancreatitis. Let me once more tell you, मेरे प्यारे भारतवासियों, जो नीट पीजी टॉपर बनने के लिए तैयार हो रहे हो, definitely one question will come from antiretroviral therapy heart. NEET PG is not for 200, it is only for 199, one MCQ definitely on HIV and antiretroviral drugs. आज रात ही 12 बजे के पहले इस टॉपिक को गर्मा गर्म खत्म करके tell me another 30 mock tests I am going to conduct, 34 mock tests I am going to conduct before April 15th. Not a single test you should go wrong in antiretroviral therapy, because that is the short topic of the NEET PG exam. Hypomagnesemia is often associated with hypocalcemia and hypokalemia. Hypokalemia, because when hypomagnesemia is there, there is a urinary potassium wasting leading to hypomagnesemia. And hypomagnesemia is often associated with a low parathormone, which is also responsible for hypocalcemia. 32-year-old female who is being treated for infective endocarditis develops an episode of syncope. The heart rate is recorded as 36 beats per minute. What is the most likely possibility? One of the complications of the infective endocarditis of valve ring abscess is something that you should not forget. Wherever और एक love sign मिल गया, शिवे हा वर्मा. Thank you, sir, for your sessions. Same time, Dr. Verma, thanks for coming to this session. That is most important. And also bring all your friends. And let me tell all of you, every day 6 p.m. there is a grand test discussion of 100 MCQs. And every day morning, download the Incus app. In that, under the NEET PG category, you have the quiz video, flashcards. Under the quiz, you have the 40 grand tests. for NEET PG, March 5th to April 15th. Every day morning, there is a new test posted along with this PowerPoint, which I am now discussing with you, is also being made available. Take the test, review the answers on the PowerPoint given to you on the Incus app, and also identify 5 to 10 topics, very important. And come down evening discussion with Dr. Murali Bharadwaz, absolutely free, right, doctor? Now, chronic heart failure. So a lot of studies were conducted. Is there any drug? There is a survival benefit. Yes, sir. Bisoprolol is what you need to remember. So diuretics and digoxin only for symptomatic management. All patients who are having the CHF need to take ACE inhibitor. That is known to improve the long-term prognosis. Now, doctor, alveolar arterial oxygen gradient, how do you calculate? If you know this formula, you know it. Otherwise, no guessing, because this is not IIT joint entrance. So, doctor, FiO2 into atmospheric pressure minus PH2O minus PaCO2 divided by 0.8, the whole thing minus PaO2. If you use all these values which are being given to you so clearly, you get the answer 645. It is the envelope antigen which indicates the degree of replication of hepatitis B. Once more, I want to tell you HBV, HCV. Don't read HAV, you ask your friends to read. But you read HBV. A little about HCV. When will you give pegylated interferon therapy? What are the indications for giving lamivudine in the treatment? And all the serological markers of HBV. Everything, doctor. You have to आपके मुट्ठी में रहना है, डॉक्टर साहब. आपके मुट्ठी में रहना है. Otherwise, examiner will play with our life. Right? Today only, whichever video library you are studying doesn't matter for me. But have you done the revision or not? In this mock test, have you taken a clue, inspiration to go back and do the revision? That's all. Rheumatoid factor is IgM against IgG. All men in the world are running behind the girls. Always men run behind girls. M behind G. Not G behind M. Severe meconium aspiration is defined as a disease that requires mechanical ventilation for more than 48 hours. So, for the meconium aspiration syndrome, clearly visual criteria are there. When they call mild, moderate, severe. I leave the literature for you. Transposition of the great vessels. What is the meaning of transposition of the great vessel, doctor? The great vessel, that is aorta, instead of opening into left ventricle, it started opening into right ventricle. Pulmonary artery, instead of opening into right ventricle, is opening into left ventricle, which is called transposition. So there is a mismatch. Good blood going to wrong place, bad blood going into wrong place. So what do you want to do? You need to switch it. So arterial switch, Rastelli, using prostaglandin E1 infusion to keep the PDA patent so that you can once more re-switch it back. They're all done, not Fontan. So where do you do Fontan? Fontan is an open heart surgery. which is done whenever left ventricular hypoplastic syndrome is there. In few kids, unfortunately, left ventricle is unable to pump. It fails congenitally from the birth. So, typically the blood flow, so from the lower body, IVC is bringing blood. And from the upper body to the lungs, the pulmonary artery. So here the lungs are bringing the blood through the venous circulation. They are pouring into the left ventricle, but left ventricle is hypoplastic. So in that scenario, what you want to do? You want to bypass that non-functioning heart and directly connect to the bad blood with the pulmonary artery so that it will go to lungs and get purified. And there is a small hole which is being created that will help the extra blood to flow until the lungs get adjusted. So that is how Fonten's procedure will completely bypass the heart and take the blood directly to the lung, get it oxygenated and bring it back. So that is what you need to remember. And in the Fonten procedure, the right ventricle, since it is functioning, you will bring the blood, after oxygenation, you will bring the blood to the right ventricle, which will pump to the whole body. What otherwise is done by the left ventricle. So that is the Fonten's procedure. Why there is a cardiac tamponade in a neonate? Pneumopericardium is a cause. What are the absolute indicator for the mechanical ventilation in a neonate? So there are certain absolute indications based on the PaO2, PaCO2, general anesthesia, prolonged apnea. Relative indications for mechanical ventilation in infant, you should know. I leave the literature for you to do the revision. CMV infection, what does it lead to? Sensory neural hearing loss. It leads to. Renal vein thrombosis in the newborn. Any infant of diabetic mother, dehydration, sepsis, anything can lead to. What are the incidents of a severe congenital heart disease in a live born, doctor? 1,000 live births may 6 to 8 is what you should remember. Now the different rarer types of blood groups, you should know what will happen with them. Duffy dies, Kelly kills, Louis lives. The Duffy and Kelly antigens, they cause significant hemolysis. Louis antigen only mild hemolysis, that is usually not fattened. Now coming to the chicken pox, varicella. Varicella is pleomorphic rash. Different stages of rash in the same place. Smallpox is same stage rash. That's how you differentiate. A term newborn, emergent cesarean, IUGR, oligohydramnios, later develop seizures. So they are hypoxic seizures is what you should remember. Facial hypertrophy is a feature of von Recklinghausen and Klippel-Trenaunay syndrome and fibrous dysplasia. 30-year-old truck driver, painful inguinal lymphadenitis. Painful inguinal lymphadenitis. How do you want to treat? Lymphogranuloma, venereum, typically caused by chlamydia trachomatis, lead to inguinal lymphadenitis, proctocolitis, and doxycycline is considered to be the treatment of choice. And what you have seen in the figure is called groove sign, is what you should remember. Once more, doctor. HSV, syphilis, LGV, chancre, that is syphilis, chancroid, Without a question in this, doctor, there is no NEET PG paper. Take it as my word. A butcher developed a tender purple red block. So, what is that, doctor? Butcher साहब ने उनके हाथ के ऊपर tender purple red block developed. What is this condition? Erysipeloid. Acute cellulitis caused by Erysitrix rhizopatica. And penicillin is considered to be the treatment of choice. Homosexual carpenter. पहले से carpenter, ऊपर से homosexual. Anoreceptive intercourse. And the squamocolumnar junction of the anal canal, perianal skin. Typically, the anoscope findings are being shown to you. So what do you see? Genital human papilloma virus infection with the warty lesions. Typically, when you apply the glacial acetic acid, then it turns white visible areas if there is a subclinical HPV. 60-year-old malnourished patient who had burns. What is this you are expecting? Typically, they can develop ecthyma gangrenosum, which is caused by the Pseudomonas. Malnourished female burn patient with Pseudomonas bacteremia with ecthyma gangrenosum. During mechanical ventilation, mean airway pressure. It is affected by inspiratory time, peak inspiratory pressure, all of them. Once more, doctor, ventilator, Maple-Sun system of ventilation. Everything you should get ready for the tomorrow's NEET PG. Least hepatotoxicity hota hai sevoflurane. Halothane is most hepatotoxic. Soda-lime granules, 4 to 8 mesh. Cyclopropane cylinder, amma. 1 cylinder code, color code. Definitely aane wala question hai. Typically orange. Renal failure, it is the isoflurane, which is the anesthetic agent of the choice, is what you need to remember. So, doctor, Shanti, Shanti, Shanti. Have a great dream. Have a great respect on your energy levels, intelligence. You know, you are one among the few people who made it to the medical college. Already one challenge you have proven that you are the Bahubali. You are born with a purpose. You are born to become a great neurologist, neurosurgeon, cardiologist, cardiovascular surgeon, right? Some of you are plastic surgeons, orthopedicians. You are born to become that great. Every day when you wake up, tell yourself the great prayer that I'm born to become that great. I still have 35 to 40 days. Must doctor, 35, 40 days, you can rule the world, right? Provided you know how to revise 400 to 500 topics. I will give you 4,000 MCQs in this 40-gram test and discuss with you. Every day I remind you 10-15 question topics which you have to pick up and do revision. Just to do it religiously. Morning, open the Incus app, take the full-scale grand test, 100 question wala, and then get ready for the day. Good luck. See you all tomorrow at evening 6 p.m. Good night.